Hi and welcome. I'm Liz, Assistant and Account Executive at Allied National. Thanks for joining us today for the Bridge to Medicare webinar. We're going to be joined by Robin Deppenbrock, very knowledgeable Director of Agency Services with Pivot Health. And we are super excited to go through some of the awesome points for the Bridge to Medicare program. Before we start, I wanted to remind you all that the phones are muted for the webinar. If you wanted to ask a question, there's going to be a section on your GoToWebinar for the question box, and we'll be glad to answer them at the end of the webinar. We are going to be recording it, and we'll send you a copy of all the answered questions. Even if there are some that we're not able to get to today, we'll go ahead and send a listing of all the Q&As out, along with a link for the recording. So at this point, I think we're going to go ahead and turn it over to Robin so that she can get started and give us all the ins and outs on the Bridge to Medicare program. Robin?
Great. Thank you, Liz. Thank you, everybody, for joining us as well. Well, thank you, everyone, for being here. Sorry about the little technical difficulty. There's always something that happens. So we're going to go ahead and get started. I want to go over today a little bit about who Pivot is as a company, what we do, go into the market as we see it as a good fit for our products, go into our products a little bit that we have, our short-term medical products that we have, and then our newest product, which is the Bridge to Medicare plan. So we'll go ahead and get started so we can get through all this and make sure we end on time today. So the next slide, please. So first of all, who is Pivot Health? Pivot Health is not an insurance company. We get this question a lot. Pivot Health actually launched their first product in 2016, and Pivot Health is a product development, management, and marketing company. So we provide alternative insurance solutions to the individual market. Our team of leaderships come up and they develop a product. They take that product to a carrier. In our instance, all of our short-term medical products are insured by Companion Life, and then we use Allied National as our third-party administrator. They do all of our administration as far as billing, claims, customer service, and commission payment. So we're happy to have that. We're kind of like a three-legged stool, so to speak. So once we have that product, we then bring it to market. And our team of leadership is made up of kind of hand-picked professionals. They're proven and successful marketers, risk managers, product development experts, and all have been in this market for many years. The founders of our company have been they've been very innovative in this type of market and the alternative solution market for a long time. They manage more than $7 billion of insurance premium. So we have a real strong backing with Allied as our administrator, and then Companion, who's A+ rated, been in the market for over 40 years. So very strong backing, very strong leadership team. And then just to give you an idea of our growth, in 2017, we marked $5 million in revenue. In 2018, we were at $44 million in revenue. So we had a big jump in growth. We expect to double that this year, and there's a lot of reasons why. Next slide. The biggest reason we feel that this, why we're going to do so well, is the market itself. This market that we're in today is big for short-term medical products, and it's just getting bigger. The short-term medical market really started to grow when ACA came about. You know, there were people that didn't want to go on ACA, so they looked for alternatives. As ACA went on, of course, we all know premiums went up to be unaffordable. Carriers were pulling out of the market. They stopped paying commissions to agents. Everything that we know that happened in the market just really helped people look for alternatives, and where short-term came in. And then lastly, why our market is just getting bigger and bigger is because of the recent regulations, which allowed some states to choose to be able to take policies for short-term medical to go to 364 days, and also taking away the tax penalty. So that helps our market get bigger. You know, the market, again, in itself, it's diverse and dynamic. And what I mean by that is, you know, one of the downfalls of ACA, I think everyone will feel comfortable agreeing with, is that they tried to make insurance be one size fits all. And take it from a person that does a lot of shopping. I know that one size doesn't fit all. It may fit some, but it's not going to fit everybody. So that's a problem. We have a lot of diverse people, and the fact that there's a lot of niches out there. There's individuals that are between jobs, self-employed, early retirees, people on COBRA. All of these people are people that didn't fit into that ACA world. Aging off, kids today age off a insurance plan when they're 26 years old. Well, it just so happens the largest uninsured population is age 26 to 34. And it makes sense. Their parents have paid their premiums for insurance their whole life. They don't really even know what an insurance premium looks like, and then they see it on ACA and they say, forget it. The highest uninsured age is age 26. So great opportunity for short-term to come in and help insure that market. The demands of the market is speed. You know, the way our society is today, everything is instantaneous. It's immediate satisfaction, immediate gratification. So the process that you have needs to be fast and simple, and we think we help in that way as well. And again, the last thing is, if you've heard any of my presentations before, you'll hear that, you know, permanent is ending and we're entering into a gig economy. And a gig economy is when people want to do their own thing. They want short gigs and they want to be able to move and be their own boss. FreshBook put out a report that predict that 27 million Americans will leave their traditional workforce for self-employment in the next 5 to 10 years. People want to do their own thing. How many times have you been in an Uber and asked somebody what they did before this? You know, some of them have left corporate worlds. Some are early retirees. Some are retirees. They're just looking for something to do. But again, people want to work for themselves. And it might surprise you to know that most entrepreneurs are not millennials. The average age of an entrepreneur is 42 years old. So again, our market just continues to get bigger and bigger. Next slide, please. So let's talk about the short-term products that Pivot Health offers and why we're unique in the market. Next slide. First of all, short-term medical is not a new product. It's been a niche market for 40 plus years. Again, with the growth, the number of individuals is about 1.5 million that are covered, and that was more likely then to double in 2020. The total in-force premium for short-term is 1.5 billion. It's looking to get to more than 5 billion in 2021. So again, the market is getting bigger, 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 and this is something that we think is going to be sustainable. Next slide. So we have products that we feel fit every need for your clients. We think that the way our products are kind of put together and the array of product options that we have and duration options that we have, we can find a product that fits any client's needs or budget. The first set of plans that we have are the core plans. The core plans are really geared to the younger generation. You know, they have very low deductibles, they have doctor visit copays, they utilize the First Health Network, they have prescription drug coverage. Our core and classic plans, eligible individuals can be age 6 months to 64 years and 11 months. So on both ends of the spectrum there, we are a little bit different in the market. First, we go down to 6 months. We also take child-only applications at age 6 months. As long as they've completed their first well baby visit, they can have coverage at 6 months. And we also go up to 64 and 11 months. Most carriers stop at 64 and a half. So again, it gives us a little bit of an edge on a niche market that we can fit our products. The core products have fixed hospitalization benefits. Now it doesn't have fixed indemnity benefits there. It has fixed dollar benefits. So it pays up to a certain amount for hospitalization. And I'll show you what that looks like in a few minutes. The classic plans have been the plans we've had in the market since 2016. They're They have plans with doctor office visit copays, with prescription drug coverage, up to $1 million coverage max. Again, these plans take child only. The classic plans use open access, so there's no network restrictions, reference-based pricing. If you work with Allied today and you're working with any of their group business, you're probably familiar with reference-based pricing. Somewhat new to the individual market, but not new to the overall insurance market. We also offer multiple duration options, which I'll show you a little bit how that works as well. And then finally, our Bridge to Medicare product. This product is brand new to the market, just came out around January or February of this year. It's exclusively for individuals that are age 62 to 64 and 11 months. And what we do is we issue 3. If you buy it at age 62, we issue 3 12-month plans at one time. So if you bought it at age 63, we're going to bridge you to Medicare. So we're going to issue the number of policies to get you to the Medicare eligible age. Every new policy, so 2 and 3, has no new underwriting. It will just start automatically. If you've written any Pivot Health business in the past, we had a 4x3 plan, which was 4 90-day policies issued at one time. One policy ends, the next policy starts, and everything starts over. This is how this works, but it's actually 3 12-month policies issued at one time. They have a prescription drug coverage, and our goal with these plans was to be lower than ACA. We wanted for this age group for our rates to be 40 to 50% lower than ACA, and that's what we did. We also, for an agent, wanted to give them a product for this age group that gave them a higher lifetime value. Paid them commission, real commission on the plan, kept the persistency on this plan. So those are the things we were looking for Bridge to Medicare. Next one, please. So what makes our plans different? So our short-term plans are different in a couple different ways. One is that we have an array of plan options and duration options to get a plan that fit your client's needs and budget. The other is we have plans that have prescription drug coverage, doctor office visit copays, and $1 million maximum, all on one plan. Our plans start as 24 hours from enrollment. So they can start as soon as the next day, or they can start 60 days in advance. We accept child-only applications starting at 6 months. We cover high school and college athletes. No other short-term medical policy does that. Our core plan utilizes one of the largest PPO networks in the nation, which is the First Health Network. And our classic plans, again, have no network restrictions. It's freedom of choice. And I'm going to go over how that works in a few minutes. Next one. Oops. There should be another one ahead of that. So this is a video we have available on the agent resource page, and it goes over how reference-based price works. Basically for us, reference-based pricing is a percentage of Medicare. We call it Medicare Plus. You might know it as usual and customary, but basically Pivot pays a provider up to 125% of Medicare allowable and pays a facility up to 150% of Medicare allowable. The insured receives an ID card that states those reimbursements right on the ID card. There's also a benefit verification line that we urge the client to have their provider call so that they can call Allied to hear how the benefits works and how that they just file a claim like they normally would. The claim is repriced by Allied based on the Medicare allowable. The provider is paid based on that Medicare allowable. And then the insured receives an EOB with their what they owe, whether it's deductible or coinsurance. What we offer, again, is called a no balance bill guarantee or balance bill protection. So what we say is that if one of your clients goes to a provider, the provider sends the bill into Allied, it's repriced, and then that provider comes back, they accept the repricing, and then it comes back and bills your client for a balance bill or they want to get more money, they want to get closer to what their retail price is, what they charged, that member can send that bill to Allied, and they have a team of negotiators that will work with a provider and negotiate that fee for service. Any negotiated rate above what has been paid based on the reference-based pricing, Pivot will pay. So the insured will not be responsible for any balance billed due to the discount. Next slide. So this kind of gives you an idea of what a claim would look like. The billed amount's 1,060 based on this CPT code in this zip code. Reference-based pricing paid 125% of that Medicare allowable, which paid $278.40. If the deductible was met, the insured would owe 20% of that. That would be their co-insurance. If the deductible wasn't met, they'd have to pay the $278. But paying the $278.40 is over $750 savings compared to the retail amount. So it is a deep discount. Basically, the reference-based pricing, I get a lot of agents that say, well, that's great, but they don't really get a discount then. The pricing, the reference-based pricing equates to an average of 62% discount. An average network discount is going to be 30 to 35%. So it really is a very big discount. So lowers your clients out of pocket that they would have to pay. Next slide. And just to give you an idea of, that sounds great, but how does it really work? Well, we received information from Allied on claims that were paid last year, and we paid over 63,500 claims last year. 98% of those went through without any problems at all. No negotiation, just took the reference-based pricing, no problems. We did have 376 appeals, which meant that they came back for more money. We were able to negotiate those. We only had to pay 14 claims at retail price. But the great news is the insured never knew it. They paid what they had to pay based on the reference-based pricing, and they're out of pocket. Next slide. I had mentioned that we have different duration options. This kind of shows you the duration options we have today. It shows you the states where it's allowed to have 364 days policy. We have that in every state that it's allowable where we are. But then you'll see the arrow states. Those states is where we have that 4x3 plan that allows the insured to have 360 days of coverage. Now remember, it's 4 90-day policies. So every 90 days, one policy ends, a new policy starts. Now there's no new medical underwriting, there's no new pre-X look back, and there's no new enrollment fee, and there's no rate trending, but their deductibles and co-insurance out-of-pocket maximum will start over, but so does their co-pays and coverage maximums. So in these states, we are allowed to go a little bit longer, and we go longer than our competition on a policy. And just to give you some stats, in the states where 4x3 is the longest duration that we can offer, our sales are they average about 49% are in that longer duration. Makes sense. In some of our top states where we have 364-day plans, we're still selling about 13% of 4x3 plans. And the reason is it's a price point. It's going to be about 30% less than a 364-day plan. And that's because of the different risks that's involved. So if you need a price point and someone doesn't care that the deductible is going to start every 90 days, it's a good option to review. Next, please. And this just gives you the stats that I was talking about before. So you'll see here where the longest duration is. You'll see the percentage where we're selling. And then if you look at the 364-day states, again, average is about 13%. We're still selling 4x3. Next slide. This just shows you the different plan options. So when I talk about the classic plans, I'm talking about choice, economy, and deluxe. When I'm talking about core, you'll see the core 2000 here. Now, of all of our plan variations, if you just ran a quote and you got every plan possible for the short term, excluding Bridge to Medicare, you'd have about 39 different options. I'm going to give you a little hint and tell you that the Choice Plan, $5,000 deductible, is our top selling plan by far. You'll see the premium. This is a 180-day plan for a young family in Illinois. Husband's 35, wife is 33, and the children are fairly young, 3 and 1. So the choice plans are most popular. It's got a great price point. It has doctor office visit copays, which are $3 per person per policy. And it also has the $1 million maximum. And this is open access plan. Then if you're the Cadillac plan, I'm going to skip the economy plan for a minute. Our Cadillac plan is the deluxe plan, and you'll see the price point's almost double of the choice plan, but this has the doctor office visit copays, again, the $3 per covered person per policy, but it also has an RX rider that's on this plan, where generics are $10 copay, and then preferred and non-preferred, you have to satisfy a $500 deductible first, and then you get a copay of $50 or $75. So that makes this one a little bit richer. It does have the $1 million maximum. So this plan sells to most people that are coming off group, whether they're on COBRA or maybe they're just early retirees that are looking for really a plan that most looks like a major medical plan, and also we sell a lot during open enrollment. The economy plan is going to be your price point plan. This is deductible and co-insurance for everything. This is for maybe your 26-year-old that just wants to have coverage. Again, it's going to be about half of the choice, so it's really your price point plan. And then finally, the core plan. The core plan, as I had mentioned, has very low deductible, $2,000. Our out-of-pocket, you'll notice, is a co-insurance out-of-pocket maximum, so you have to deductible plus your co-insurance. It has co-pays on it. But then you'll see the dollar limit. So on inpatient hospitalization, we will pay up to $1,000 or $2,500 depending on the plan. So it's not a reimbursement. The plan pays up to that. Anything above that is the insurer's responsibility. And you'll see it's about the same price as the choice. It also utilizes the First Health Network. Next slide. So, remember I said our products are kind of targeted towards different age groups. Our core plans were really targeted towards the young people. And you'll see 10% of the policies that we sold are aged below 17. So again, your child only, your high school athletes, these are the ones that are buying the core plans. The classic plans, 10% of these policies are at age 62 to 64. So that kind of brought on something that we came out in the market most recently, which was the Bridge to Medicare plan. Next slide. These are our top selling states. And again, our top selling plans. You'll see the Choice 5000 is the top 3 of the 5. So we really do sell a lot of that plan. Next. So let's get into the Bridge to Medicare plan a little bit. So the Bridge to Medicare, next slide, was a plan that we came up for a specific market. And again, it's that niche market. We did some research on this, and we found that there were 12 million of the 77 million baby boomers that were between the age of 61 and a half and 64 and a half. It's about 28% of the population. And this population, 10,000 people, we hear every day, and the reason that we're in Medicare or sell Medicare is because we hear every single day that 10,000 people are turning 65 every day and will for the next 10 years until 2030. That's the generation of the baby boomers. Well, we felt like there was a need for this population that 10,000 people were turning 62, 63, and 64 every single day too, but no one was really caring about them. If you sell Medicare, You don't want the 62, 63, and 64. They're way too young for you. They need to go to ACA, or you refer them down the road to someone who puts them in ACA. If you sell under 65, that 62, 63, and 64, they're too old for you. You're just going to put them in ACA because they're unhealthy, they're going to get a subsidy, and there's nothing that you can do for them. Actually, 45% of the baby boomers consider themselves to be entrepreneurs. AARP reported that entrepreneurs over age 50 grew by 50% since 2007. And about 50% have incomes that make them ineligible for ACA subsidies. They're now in a new bucket, which we call the working poor. They make too much money to get subsidy. They don't make enough money to be able to pay their health insurance premium. And just by looking at our population alone, out of all of our membership, we found that for all of our plans, 12% of Pivot Health's current customers were 60 plus. Next slide. So, and what we found out from eHealth, the recent survey that eHealth did, is that they went to this older population, 55 to 64, and asked them some questions about why they chose short-term. 70% said that they cited affordability as a primary reason for choosing short-term. ACA is just not affordable for them anymore. 88% of this population said they value affordable monthly premiums over comprehensive coverage. They're willing to pay a little out of pocket for medical expenses. And then 64% said they would retain their short-term coverage for longer than seven months. We know the average persistency of short-term is about 5 to 6 months. So they're going to keep it longer. So next slide. We wanted to give them a solution that would provide additional coverage compared to short-term medical. They could get short-term medical today, but let's give them a little bit more, maybe something that would add extra value. Let's increase the lifetime value of the customer for the agent. Let's offer first dollar benefits for services they use most often. Allow transition to Medicare with a lower acquisition cost. Now you have a Medicare lead that's your lead, your client at age 62. When they're ready to go to 65, they're going to go ahead and look at you for their Medicare needs. And then we wanted something fast and easy. So we wanted to get a process that would take less than 15 minutes. So we introduced the new plan called Bridge to Medicare. Next slide. Again, the Bridge to Medicare plan is only eligible for age 62 to 64 and 11 months, and we issue 3 12-month policies at one time with no additional underwriting, no new pre-ex, and no waiting periods for policy 2 and 3. The Bridge to Medicare combines a short-term health coverage with fixed first dollar benefits that supplement everyday medical expenses like doctor office visits, preventative care, testing, outpatient surgery, hospital stays. Then we also added non-insurance benefits, discounts on telemedicine, prescription drugs, vision, and audiology. Next slide. So again, 3 12-month policies. Each year a new policy starts. There's new certificates, new ID cards, new deductibles, and out-of-pocket maximum and cover maximums all start over, just like typical insurance. There's no new medical qualifying questions for policy 2 or 3. There's no new look back for policy 2 or 3, and no new waiting periods for policy 2 and 3. There's a one-time enrollment fee, and they can cancel at any time. Next slide. Oops. You have to click through all these. There you go. Okay, this gives you an idea of what the plans look like. This is the kind of plan benefits. This is the short-term medical benefits. So remember, we took a short-term medical policy and we took a first dollar benefit policy. We put them together in one package. Now, your agents are probably selling package plans today. That's the key, right? The more products you have with a customer, the stickier they are. Well, we just did that for you. We did it for you in a package. So we took two plans that we felt complemented one another, and we put those in a package for you so you didn't have to figure it out. So basically, the short-term product is there for your unexpected high medical bills. So everything goes towards deductible and coinsurance. And you'll see the deductibles are $5,000 to $10,000 based on plan. Out-of-pocket coinsurance, out-of-pocket is $10,000. Coverage maximum is 250 or 500. Remember, this is per policy. So if they have 3 policies, they're really at the end of that third policy, they'll have $1,500,000 in coverage. They have prescription drug coverage, and then they have additional deductibles on certain services, but everything goes towards the deductible and coinsurance on the short-term plan. The next plan, next slide, is the limited benefit plan or the first dollar benefit plan. This is going to pay or reimburse the insured for services that are on the schedule. So basically, whatever the price is, the amount is on that for that service, it's going to reimburse the insured. It's like a fee for service schedule that pays out. There's one ID card that's issued to the Bridge to Medicare members, and there's only one claim that needs to be filed. Next slide. The added association benefits to this plan, again, the non-insurance benefits is the telemedicine. We have doctor on demand, which is basically FaceTiming a doctor and telling them your symptoms and getting a prescription. We have this on all of our short-term medical plans. It's a $49 fee. On the Bridge to Medicare plan, if the insured sends in their receipt for payment for that $49, we'll reimburse them the whole $49 fee, so it's basically free. There's discount on prescription drugs with up to a 70% savings. And then again, there's discounts on vision through Davis Vision and audiology, hearing exams, and hearing aids. Next slide. Just to give you an idea of premiums, I'm sure you're wondering. Remember, I said that we wanted to be about 40% to 50% lower than ACA. So we took some of our key areas where we're selling or have the product approved, and we took the ACA plans and we matched them up with the premium. So you see where it's yellow highlighted, that's the Bridge to Medicare. Plan 3, which is our richest plan, the lowest deductible with a $5,000 deductible, that best suits the ACA plan that we put it up against. So again, the Bridge to Medicare plan uses the same reference-based pricing we had talked about earlier. Pays providers up to 125% of Medicare allowable and up to 150% of Medicare allowable for facilities. They receive one ID card. The ID card is shown to the provider. They can call the benefits verification line, and basically the provider sends the bill in, it's repriced, and the provider is paid. The member is reimbursed what they should be reimbursed, and there's no balance bill guarantee. Next slide. So let's see how the claims works with the two policy. This is a claims example. 63-year-old falls, has to go in an ambulance to the hospitals in the emergency room, needed an x-ray, and then spent the night for observation. The estimated cost, we took the Bridge to Medicare Plan 3 against the Obama Silver Plan with a $5,000 deductible. The cost is going to be the same for both plans, of course. So let's see how this works with the Bridge to Medicare plan. So the claim comes to Allied, and Allied is going to go ahead and they're going to take that claim and they're going to rub that claim against the short-term medical policy. Everything here goes towards the deductible and coinsurance. It's repriced based on the reference-based pricing, but it all goes to deductible and coinsurance. And now it's going to take that same claim, and regardless of what happened on the short-term plan, it's going to hit it against the fixed dollar benefit plan or the limited medical benefit plan. And then it's going to look at the fee at the services to see if there's any fees that should be reimbursed to the insured based on the service provided. This plan basically paid over $1,000 to the insured to offset their out-of-pocket for the deductible and coinsurance. So the patient's responsibility using the extra money that was paid out was $441 on the bridge plan. On the silver plan, well, most everything went to deductible and coinsurance, to deductible, excuse me. There was an emergency room copay that kind of lowered their out-of-pocket, but still the responsibility was $1,200. So big difference in out-of-pocket or for your insured. Next slide. These are the states where we're available today. And you'll see we've got some big ones: Florida, Georgia, Pennsylvania, Virginia, Texas. Pennsylvania is actually a very, very good market for us, if anybody's on the phone from Pennsylvania. We do have 2 markets that we're hoping to have out shortly. And when I mean shortly, I mean before the 4th quarter, and that would be North Carolina and Arizona. Next slide. And then we do have other options for alternative insurance. We have 2 limited medical benefit plans. One is the Elite Plan, which is very rich, has up to a $6,000 per day inpatient hospital benefit reimbursement. The Pivot Care Economy is a little bit less reimbursement, but very, very affordable, great add-on product for any high deductible plan. And then we have a Latitude plan, which is a supplemental plan that it's like our best kept secret for some reason. It's a bundled plan that has accident, critical illness, AD&D, hospital indemnity, all in one policy. And it's very affordable. There's 2 plans, basically 2 rates. It's less, both plans are less than $100 a month. So a great, great, great add-on plan for any high deductible plan. Next slide. The process is very easy. Your agents, if they're already contracted, their Bridge to Medicare is available to them today, as are the short-term products, as long as we're in a state that it's available. And basically there's 5 simplified underwriting questions that all the short-term, including Bridge to Medicare, have to answer. They answer no to all the questions. They're issued on the spot. They sign the application with the e-signature. The next email your member's going to get, or your client's going to get, is a welcome email with a link to download their ID cards. There's no back and forth verification. So the coverage can start as soon as the next day. There is a 10-day free look where there's a full refund if they decide not to keep the plan. Waiting periods do apply to all of our short-term products, and there's a 5-day wait for sickness and prescription drug fulfillment, and a 30-day wait for cancer. This just shows you today your agents need to log in to the agent portal. Once they log into the agent portal, they have access to quoting, and you'll see that now we have all of our products listed on top. They're also able to email a comparison quote to their client, which the client can pick a plan and enroll on their own. That's a brand new feature that we just put in. So we're just trying to make it easier for you and your agents to sell Pivot. This just gives you an idea of what you can look at. These are the 5 underwriting questions. I always get asked, well, what are those questions? Again, nothing that's really, I think, earth-shattering. We don't have a height and weight chart. We only care about how heavy you are. The second one is the big one. And, there's people think that the age group between 62 and 65 is unhealthy. We found in our own analytics that about 86% of the people, overall, of the people that apply for coverage get issued. And the age group between 62 and 65, we found that 74% of them get issued. So they're fairly healthy. And I always say to people, oh, you fall apart in your 50s and you kind of get it back together in your 60s. You start taking care of yourself. If you've had issues, you're either on taking medication, or you've gotten that issue taken care of, and you're leading a little bit healthier of a lifestyle. Excellent. And this is just the end of the 5 questions. And then I'm sure everybody knows this, but short-term medical plans have pre-existing limitation provisions that prevent them from covering or for applying to medical conditions that exist prior to the plan's effective date. Typically, it is a 5 or 12 month, a 5-year or a 12-month look back. And I think the next slide is questions, but before we go into that, I did want to let everybody know that we do have 2 pretty exciting announcements that we'd like to make. One is that we've had a series of rate reductions, and the rate reductions were in about 18 states, and they vary, but they go anywhere from about 8% up to 22%. So actually, I'm sorry, 3% to 21% in the 18 states on average. The states are Michigan, Pennsylvania, Arkansas, Arizona, Florida, Illinois, Ohio, Iowa, Alabama, Kentucky, Oklahoma, West Virginia, Mississippi, Wyoming, Indiana, Texas, and Wisconsin. So all those states did take a rate reduction. That happened last week. And then finally, we have an agent bonus for Bridge to Medicare. We will pay any agent $75 for a Bridge to Medicare sale that of a submitted and approved application that we received between April 1st and June 30th. So we still have lots of time for that, for the agents to earn $75 per application. So with that, all that being said, I wanted to open it up to questions. And I think that I can see the questions actually. If you have any questions, you can go ahead and type them in the question box, and I can read them and answer them, I believe. I don't know, Liz, maybe you can see something that I can't.
I think that we are probably on about the same page, Robin, but we do have several good questions that have come in to us, so we can definitely try and tackle those if you've got your question box, or I can read them out and we'll do a little game show type.
Sure, just you can read them out, that's fine.
All right, sounds good. So we have some questions that have come in. No new underwriting on the short-term plans, including Bridge to Medicare. They just wanted to verify that they were hearing that correctly.
No new underwriting on so there's no new underwriting if they buy a 4x3 policy on the second, third, or fourth policy, and there's no new underwriting if they buy the Bridge to Medicare on the second or third policy.
And what would be the issue if, let's say that while it might not have been a pre-existing condition, if it happens during their first policy, are they going to have any difficulties with the follow-up plans?
No, so if something happens, if someone comes down with a condition, and let's say they're on either the 4x3 plan or the Bridge plan, if they come down with a condition in their first policy, that condition, and it's deemed covered and it's not a pre-X, that condition will be covered as any other illness for policy on the 4x3 on policy 2, 3, and 4, and on the Bridge plan on policy 2 and 3.
Okay, and then it looks like we've gotten a couple of different questions about when we're going to be rolling out additional states and what we might be looking at next. Do we have anything coming up for Washington State or Indiana? How about Kansas?
Well, we don't have anything for Washington State, unfortunately, right now on the docket. We probably will be going in Kansas, and Indiana is a pretty tough state. So we, keep your eye out. We have a lot coming out in the next couple of months, a lot of different duration options, a lot of different new products. We're going to be coming out with dental in June. So, we've got a lot coming out, and we're trying to get it out as quickly as possible. So, pay attention to any newsletters that you get, because guarantee there's something new in there.
Awesome. Now, John may wanted to know if he can get an average time from the submission to the issue.
Sure. So it's real time. So once they answer the 5 underwriting questions, if they answer no to all the underwriting questions, they're basically issued on the spot. It's accept or reject underwriting. So as soon as they answer no to all the questions, they fill out their, name and address and email and any spouse information or dependent information. They put in their credit card or ACH, and that they hit submit, and the next email they get is a welcome email, so they can go as soon as the next day.
All right, and so we are looking at some questions from Lynn on the core STM plan with the hospital coverage being up to $2,500. Any claims over that, are those going to go deductible, member responsibility, or are they just going to be completely separate?
No, so the deductible always applies first, and then it'll pay up to that amount. So if it goes over that $2,500, and it's per day, I should say that the dollar limit is per day, and there's no day limit. It's just that cap of dollars per day. So if it goes over that $2,500 per day, anything above that is the member's full responsibility. It's kind of considered a not covered.
And on this plan, are we going to be mailing out ID cards? Or are they going to be available just on the portal like we have on some of the other Pivot plans?
Yes, we still are only providing electronic download of the ID cards.
And as far as their premium payments, they can do ACH, credit card. Can they call in and make any additional payments to client services?
Client services will allow them to not call. I don't believe they allow them to call in and make a payment, but they can, change course if they want to go from ACH to credit card or change a new credit card. They can call in client services to do that.
Great. And I think one of our final questions before we just wrap it up and get everybody back to their afternoon, we're just wondering if this information is going to be available to the agents. I know we're going to send out the PowerPoint, but where can they go for the agent documentation?
Sure. If you should have a login to the agent portal. And if you go to the agent portal and you log in, there'll be a button when you log in that says Agent Resources. There's a ton of information out on Agent Resources, including videos. There's a Bridge to Medicare video. There's a reference-based pricing video. There's a regular short-term medical video. There are marketing pieces that can be customized. So, and there's all the information as far as producer guides and brochures that you can go out there and download.
Great. So at this point, I think we want to just say thanks to everybody for attending the webinar. We're going to schedule a follow-up webinar for all agents at a later time, so that'll be within the next month. And we're going to send you information about that event so you can share it with your downlines. And you can always reach out to any of us in the sales department. All of our contact information should be on your screen right now if you want to get any questions answered that we might not have had time for, but we will certainly be going back through all of the questions that you guys submitted throughout the course of the webinar, and we'll be answering those and sending those out along with the PowerPoint. So at this point, Robin, thank you so much for your time. All of our attendees, I really appreciate it, and we look forward to getting some of these sold.
Sounds great. Thank you.
Have a great afternoon, everybody.